I'm Dr. Ruben, Bhasin, Dermatologist at Birla Hospital, Gurgaon. Today, we will be talking about dermatomyositis. Dermatomyositis is an idiopathic inflammatory myopathy, which majorly affects the skin and the muscles. Like the name says, dermato meaning skin and myo meaning muscles. The major issues they happen in the skin and the muscles. Now, when we talk about the symptoms of this disease, when the disease starts to occur in 40% of the patients, cutaneous manifestation, that is the skin changes, they precede the muscle changes. In skin changes, what would the patient see? It is majorly going to be redness around the eyes with or without swelling. Thick eruptions around the knuckles, which might involve the nails. These are the two very characteristic signs. Photosensitivity. Now, photosensitivity is so extreme to natural and artificial sources of light. The patient has very thick erythema, redness around photoexposed sites, meaning all these sites that the sun or the artificial light is touching. So, central part of the face, your hands, everything will be severely affected. Majorly your neck, that is the way of the neck. Scaly scalp, diffuse hair loss. These are little changes they start to tell that the disease is happening. Now when we go about the muscle changes, muscle fatigue and weakness starts to happen in daily activities like walking, climbing stairs, getting up from a sitting position, combing hair, taking anything which is above rising the shoulder level. The patient will starting to have problems in that. We have certain systemic involvement also in the disease. So painful swallowing, abnormal voice of the patient, severe some conduction effects that is relating to the heart. When I talk about the joints, that is majorly affected in children, which is we call the contractures. Now, how do we diagnose a patient who walks into our OPD with dermatomyositis? So, the two characteristic signs were the rash around the eye, that we call the heliodrop rash, and certain eruptions around at the back of hands. On the knuckles, those are the grotal papules. These two are the characteristic pathognomic features of the disease. With this, we will be checking the neck of the patient that will have certain erythema, majorly around the cheek, around the neck, and the photoexposed sides will have erythema and certain lesions which will be a little purplish in color. And we have to also run certain tests which would show elevated muscle enzymes, increased dermatomyositis specific autoantibodies, skin and muscle biopsies done to confirm the diagnosis. And when all of this is done, we do certain systemic tests also, like pulmonary function test, electromyography, electrocardiography, esophageal manometry. All these tests, we just get to know the muscle involvement in the patient. So the goal of the treatment is to basically arrest inflammation in skin and muscles and to obtain total clinical remission so that the patient is comfortable in performing daily activities at least. Total avoidance of sun, strict, very, very strict photoprotection, including physical photoprotection. And when I talk about the medicines per se, we generally start with class 1 and class 2 topical corticosteroids, broad spectrum sunscreens, antipruritic agents, immunosuppressants, and pulse dye laser. It helps in the redness of the skin. And lastly, the newer therapies are the biologics. They help at the level that the autoimmune reaction halts during the disease. Rest, the prognosis of the disease is good in 20% of the patients as the complete clinical remission is noted. 5% of the patients might go in a complicated disease, but it has a good prognosis. Thank you.